Let's take a moment to catch everybody up on the COVID-19 pandemic. Dr. Alissa Clough, president of Inpatient Physician Associates in Lincoln, is here to do that. Dr. Clough, thanks for joining us.
Thanks, Dennis.
Let's start off by talking about COVID rates and hospitalizations, which for the most part seems to be a pretty good trend. And you're saying even at Bryan, you're seeing fewer number of patients.
Yeah, Dennis, we are very encouraged by what we're seeing with hospitalizations across the state, and particularly at Bryan. Today we have 11 individuals hospitalized for COVID or related illnesses, down from a peak of about 160 back in November and December. So very encouraging.
Yeah, it is. And part of that may obviously have to do with vaccination. So let's talk about that. On average, Nebraska is vaccinating more than 14,000 people per day. The state has moved into the category of those between ages 50 and 64. We're seeing some local health districts open up vaccinations to even much younger age groups. So what do you think about the vaccination process? Is it going faster than we anticipated, and is it going smoothly?
Right. I think early on there was concern that maybe we weren't vaccinating fast enough, and that certainly has increased here over the last month. Incredibly proud of the efforts statewide that are ongoing right now for the vaccination efforts. I think nationwide, 2.5 million a day. And as you said, I think here in Nebraska, about 20% of individuals are vaccinated.
So the Department of Health and Human Services reports that variants of the COVID-19 virus from Brazil, the UK, and California are all now here in Nebraska. There's some question as to whether these vaccines will work against these particular variants. So how are the variants playing into the bigger picture of fighting this pandemic?
Right. I think the variants are the normal evolution of viruses, and so it's not unheard of, but fortunately it appears that our vaccines are currently effective against the common variants that we are seeing, the UK, the California, et cetera.
When it comes to the vaccinations, we've heard about some vaccine hesitancy. Maybe that's in minority communities. Maybe it's not. I mean, there's other people that are also hesitant to get the vaccine. What's your message to those people?
Right. I think the message is to get information, correct information from your healthcare providers, from science, et cetera. All the data right now has showed great efficacy, low profile risk for side effects, et cetera. So, really the message is please go tell your loved ones about the vaccine, go register, go get the vaccine when available. Really, that's the best way for us to end this pandemic.
We're starting to see some events, athletic events and other events start to open up a little bit. People are kind of breathing a sigh of relief about that. But is there some danger in becoming too complacent at this point?
Right. I think we still need to take caution and do what we know is right and what we've learned through this pandemic, not to let up on that brake too soon. I think as more variants become evident, I think there's still a lot of information still to be learned. And so we really want to keep doing what we've done for the last 12 months. We realize everyone is tired and ready to move on, but I do think there's light at the end of the tunnel, and that light is vaccine.
And just a few seconds we have remaining. Are you optimistic?
I am optimistic, yeah. I do see light at the end of the tunnel, and vaccine is that message.
All right. Well, we really appreciate your time today. Thank you very much, Dr. Alissa Clough, president of Inpatient Physicians Associates in Lincoln. Thanks for your time.
Yeah, thanks for having me.
If you have questions about the vaccination process, you can check out the frequently asked section at bryanhealth.org/vaccine. There are videos there in a number of different languages about vaccinations. You can also follow the NET News team's ongoing coverage of the COVID-19 pandemic. You can find that at netnebraska.org/coronavirus.